Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right. So I welcome one and all tonight again for the class on prolapse. Now, if you do attend this class properly today with me, this 1 hour is going to be enough for you to understand, retain, remember prolapse, and probably forever. Clears all your concepts regarding prolapse. Today, I'll be taking up the basics of prolapse. I'll be dealing with the most important quantification systems tonight, and which is why I have kept management for a separate class. Okay, so I've got, as you can see already on my screen, there are only just 25 slides tonight, and I'm going to be dealing up with the the most basic concepts, the thing that you find most difficult. Okay, of course, POPQ grid classification, not just the understanding, but also quizzing. I'll be quizzing you towards the end so that I'm sure that you've understood the concept, right? Like I said again and again, I'm telling you to please enter the chat box so that you're with me throughout the class. There is a complete communication between us. Any time that you find that you're not able to hear my voice properly, or you cannot hear the audio properly, please let me know. Now, I had posted the POPQ package on the Telegram channel. That was not to promote the package. That was actually to tell you that there is a separate dedicated package for Prolapse for those students who have not probably purchased my entire course, because the ones who've taken my updated theory course, they get automatically the entire bundle of everything is available over there. But those students who do not have my updated theory course, they can individually study Prolapse POPQ quantification system if they are having any difficulty in understanding it, right? So guys, if you do not have that, please go ahead and buy it. It's hardly of any amount, so you can easily just go and clear your concepts. There are not just only these 2-3 videos which I'm going to be showcasing in my class anyways. There are going to be a lot of other videos on prolapse, because you need to visually see prolapse quantification to be able to understand it and then keep it inside, right? To be able to do it in your examination. So I'll be starting with prolapse now. We have a sufficient number of participants. And guys, again, tonight, since I have now a full house, I have a couple of students whom I wanted to. Please, guys, just take 2 minutes of your time. Just go to the chat box. Write down the good DNB institutes of your area, good in academics, good in hands-on, and please send it right now in the chat box. I'm waiting for 1 minute from all my students who are from different places. Because of the counseling and everything going on, or whatever it was, this is a question always asked by me, and I don't find giving an answer as broad enough to my students. I want to pinpoint and tell them which college is good for what, so that they're able to make a informed choice. So all of you, please, I request you to write down in the chat box those institutes at your place which you find are good for DNB academics. Okay, so you're free to do this exercise anytime and let me know. I hope you all can see my screen and can hear my voice loud and clear. I'll be sharing a couple of videos with you. They are my videos, my tutorial videos for POPQ classification system, quantification actually. And towards the end, we'll be doing a grid, all of us together, right? So for you to understand, the grid is very, very important. I'm sure it's being done as a regular exercise in all your institutes, but I would still want you all to stay with me and learn it the way it is supposed to be, and in a very fun way, and in a very easy way. I'll make you understand the entire system of prolapse without much effort. Now, let me tell you that this risk factors for prolapse, or the pelvic supports for the prolapse, that they don't let the organs literally slide down, or the etiopathogenesis, or the clinical features of differential diagnosis. This becomes the undergraduate level. You've been taught up till now all these things to be spoken. This is going to be asked in your Viva, right? But that does not usually be asked at the time of your prolapse case if you get during your post-graduation Viva. So what happens is that the emphasis mostly is on the quantification system, your diagnosis, your ability to understand a little bit about urogynecology, and then decide the plan of management. for that patient, considering her age, her, fertility status, and her, other, predisposing factors along with the prolapse. So what is most important is actually the quantification and your management, a lot of which depends upon the quantification itself. So this is why I have taken it through two separate classes. One is about the quantification system and the other one will be upon the management. Management I'm going to take in the next class because it's not a very simple management. It's about complex things being involved. It's upon the age, as I said before. It's upon the degree of prolapse. It's upon the choice, the desire of the patient. What does she want? The quality of life. So all these things that I'm going to take it up in the next class. Now, already we've 10 minutes late now. Let's start with the definition and then a little bit of, when I say that these things are not important, does not mean that I'm going to be skipping those things through. You know why? The reason is that if at all you're always started from the basics. Once they know that you're well versed with the basics, they quickly move towards the higher questions. Okay. Being an examiner of the of the level of postgraduates, they know where you have to direct them to. But these questions will not be skipped. They can ask you and they will ask you these questions, right? So we have to touch upon these important things, but in what depth, that I'll tell you. So prolapse is all about this, right? First of all, you define what prolapse is. Second, you tell me what exactly are the things which are not letting the prolapse happen. This is what I'm going to be talking about. So pelvic organ prolapse is nothing but a protrusion or herniation of the pelvic organs, right? Outside or into the vagina. Basically, why? Because the anatomical supports, they are failing them. See, gravity is going to pull down everything. Even the skin starts sagging down, right? So this is the basic mechanism of the body. The moment the tone is gone, it starts sliding down. But such a kind of thing that internal organs start herniating out, that becomes not just embarrassing, it becomes dangerous as well. So very important is that we get to know it in time, catch it in time, and we are able to, kind of reverse it back, or at least, stop the growth any further. So now the question arises that why some people have it and some people don't. So what are the supports? Now, all of you who have seen my anatomy classes know that I have taught in detail about the pelvic diaphragm, the attachment of the pelvic diaphragm, how it becomes one bowl. It's like a bowl, right? And you know how the diaphragm is the normal diaphragm in our body, right? So it's like a segregation. This is the thoracic cavity, this is the abdominal cavity. In the same way, literally the same way, this bowl, this levator nine, this is how I have taught you before. All those who have attended my anatomy classes know this now. So I've taught you like a bowl. So it's like a pelvic diaphragm, we call it. It kind of separates the abdominal cavity from the perineum. Right? In the perineum, we spoke about, you remember the urogenital diaphragm, the anorectal triangle, and, this entire space of deep perineal pouch and superficial perineal pouch. This is all perineum. So it kind of separates it from the perineum. And perineum is the one where these orifices are. And these orifices are the ones from which the herniation of these internal organs has started taking place. Right? So pelvic supports is very important. If you know this much, it will help you enough. Right? Then the hammock theory and all, this is hammock theory. Let me finish over here only. It's nothing but the fibers of levator nine. They are so made. You know how they are? All of them have an attachment on the pubic symphysis, right? So puborectalis, pubovaginalis, or pubourethralis, they all have this attachment towards the pubis and they move like this. They make a U. So everything in between them, the orifices which are there, the urethral orifice is there, the vaginal orifice is there, the anal orifice is there. They are like taking it like a hammock and pulling it towards, anteriorly. But finally, this is nothing but a muscle. It's not a ligament that's pulling it through. It tends to get lax with age. The tone decreases with age. It decreases with so many factors which we're going to discuss later on. So let's start with the different factors. So let's start with the Delancey support system. So you have different levels, level 1, 2, and 3. So first of all, let's talk about the top level in which the cervix and vagina, they are supported by what? The cardinal ligaments, which are like, they're fanning like this, and the uterosacral ligaments, which are fanning like this. Whenever we talk about the hysterectomy, we talk about kind of pulling up the uterosacrals and then cutting them, right? And clamping and cutting them. So this is your Delancey's support system number 1, level 1. Then comes the Delancey's level 2 support system, okay? So the middle third of the vagina, where does that go? The most lax, the most, less in tone place. It's nothing but attached to the arcus tendinous fascia pelvis and the rectovaginalis. So these are two just fascias, okay? This is just two fascias. There are no ligaments actually, they're just fascias, which is why, it's pretty capacitated, especially during the childbirth. It helps actually. Then comes the lower third vagina. The lower third of the vagina, that's supported by your perineal muscles. Here is where the levator comes. Here's where the coccygeus comes. The transverse perineal muscles come, the ones which get cut during the episiotomy. So perineal body, perineal membrane, very important. Perineal body, perineal membrane, these are all level 3 Delancey's support system. That's all you need to know. Examiner is going to be very happy with you. Okay. Now, risk factors, we'll quickly go through because it's very, very, very simple. Even if you don't learn, if you don't look at this slide also, you'll be able to tell me. So there are a couple of predisposing factors like genetic factors, Ehlers-Danlos support, syndrome, or your Marfan syndrome, where already you have tissue defects and tissue problems. These are the certain predisposing genetic factors or the family history of prolapse. Then there are certain inciting factors where you will talk about your pregnancy, because pregnancy is, it's a state where you are increasing the abdominal, content. So it's pushing down everything, right? Simple as that. Number one. Number two, delivery, childbirth. Like I said, so much of, intra-abdominal pressure with so much of, trauma. You're literally cutting your pelvic supports over there. Of course. So the more number of, deliveries, normal deliveries, the more problem or the more prolapse. If you must have seen, you will see that mostly it's the number of normal deliveries that the patient is coming to you with prolapse. You'll hardly see a cesarean patient having prolapse. Hardly. Now, of course, apart from that, you have forceps delivery, young age at delivery, when the support system was not that good. That time you had multiple deliveries, prolonged second stage of labor, the heavy weight of the child. This is associations, okay, not proven but associated, definitely seen. Promoting factors, the ones which promote, prolapse, like obesity. A patient who's obese, a lot of weight hanging down the patient's body. That will cause it. Smoking is seen to be a factor, because so much time, the pressures again and again, you're increasing the abdominal pressure. Every time you're coughing, your pressure is increasing. Chronic obstructive pulmonary disease, the same reason, almost the same reason. Constipation, chronic constipation, for the same reason. Heavy weight lifting, somebody who's into heavy weight lifting, you can tie a belt around for other herniations, but what about down there? So yeah, physical work, heavy physical work, immediately after childbirth, especially if you're doing all this heavy work and stuff. So you can easily have this problem.